All right, so after your examination, let's talk about your wisdom teeth based off the panoramic x-ray that we have. So your wisdom teeth are also known as third molars. Molar number 1, 2, and 3. You have 2 up top and also 2 on the bottom. These teeth are what we call impacted. That means they're trying to come into the oral cavity, but unfortunately there's not enough room. So as they try to grow in, they'll hit adjacent structures such as the second molar and also the cuff of bone. The problem with this is that over time, they'll accumulate plaque and also debris causing decay and infection, just like any other teeth. And because they're very difficult to clean and provide good hygiene, often this particular area will become chronic in nature and cause bone loss in the 5-year or 10-year range. In terms of taking out your wisdom teeth, there are some complications associated with them. For the upper wisdom teeth, right here are your sinuses. There's a small chance, 0.25%, of that sinus having a communication with your oral cavity. So what that means is that when you drink water, water often will come through your nose. We don't want that to occur, and we want to make sure we minimize the complication, and we can do that through A, not using a straw, B, avoid smoking, and finally C, when you are sneezing, please have your mouth open to not build up pressure in your sinuses. Now for the complication on the lower wisdom teeth, there are 2 nerves called the inferior alveolar nerve. There's about 1% chance this nerve can be damaged through the extraction process. This nerve is sensory in nature, so there's a chance from the corner of the mouth to the middle of your chin, you'll be completely numb for the rest of your life. But this particular condition afterwards for males will be kind of difficult in terms of shaving. You can cut yourself and not know it, so we strongly recommend you invest in an electric razor or always be in front of a mirror when you're shaving. For females, applying lipstick and chapstick can be a little tricky. The good news is about this particular nerve, it has no motor component whatsoever, so you won't have any functional deficits. You'll be able to eat just fine, speak just fine, and smile just fine. So that concludes the indication for getting your wisdom teeth extracted, as well as the major complications associated with them. Now, if you're ready to schedule with us, please come to the front desk, and we will schedule your appointment, as well as provide you with a SIQ chip for your command, so they're fully aware. Thank you so much for visiting our clinic, and hope to see you soon.